Good evening. Thank you all very much for coming. Great to see everyone here. So the talk's about first aid for the young rider, which is it's going to be quite broad because I'm just going to touch on quite a lot of stuff, which I hope you're all going to find useful. It's not going to be that long a talk, I don't think, but you never quite know. And then there's going to be loads of time for people to ask questions and stuff. So that's what we're hoping, that people are just going to fire questions at me, which everyone will find useful, and I'll be able to respond to those. Just a few housekeeping things. We've got no horses here, so if there is a fire or anything like that, no one needs to worry about that at all. We would have dealt with that anyway, but there were no horses here tonight, okay? There are several fire exits. We've got one there, we've got one where you came in, we've got that one, and we've got that one. So there's lots of escape. You then all go outside, and you'll all go into the car park and just congregate in the car park. Hopefully there won't be a fire. So, and hopefully the technology will work. We've already had lack of battery, lack of password, lack of all sorts of stuff. So hopefully it's going to be okay. So the basics. Really the first thing about first aid is my horse okay? Is my horse ill? Is my horse acting normally? What do I need to know? What's important? So the first thing really is what the medical world go BAR. Is your horse or penny, is he bright? Is she alert? And is she responsive? So basically, when you go into the stable, is she just, or he saying, hello, I'm here, everything's okay? Then if they're not looking quite as bright as they should be, or they're a bit quiet, or they haven't eaten their feed overnight, or something like that, we then start to think, well, maybe something's wrong. So let's just have a little bit of a sort of more in-depth look. So we're going to look at the temperature. So this is really important, okay? Is it more than 38.3 degrees? Really 38.5, but let's say 38.3. It doesn't matter how cold the horse is. If the horse is too cold, your horse will be incredibly ill, and you would have called us a long time ago. People get really concerned that their horse's temperature is 36 degrees or something. You really don't need to worry about that. This is the big thing. Is my horse's temperature above 38.3 degrees? The next is the heart rate. So a normal horse's heart rate is about 40. Should be slightly less than 40. Technically it's 28 to 40, but most of them sit around 40. We get worried at 60. We get very concerned at 80. And they're your three cutoff points. So if you take your horse's heart rate, which I'm going to go through how you do all of this, so don't worry. You're fine if it's 40. If it's 60, you're a bit concerned, and if it's 80, you probably would have called us anyway. Then you've got your breathing rate. That should really be about 12. So anything above 12, that's something to worry about. Below 12, that's fine. They can breathe at 6 breaths per minute, which is incredibly difficult to pick up. But 12 is fine. Have you produced any droppings overnight? And what are the droppings like? Are they normal? Are they too hard? Are they too soft? And then we've got the digital pulses, which is another thing really for laminitis particularly, but it's a pretty important thing for you guys to try and learn how to do and all that kind of stuff. If people get too hot, just let me know. Right. You never know. It's probably quite cold in here, so if it's quite cold, sorry. Right, so we've got the basic clinical exam. So what I'm going to do now is I'm going to show you a video. You can try and guess what I'm going to say, which goes through the clinical exam, okay? Because we don't have a real horse here. Now we're just going to run through doing a basic clinical exam on Star. First of all, we check the mucous membrane colour by lifting up the upper lip. You can also test the capillary refill time by gently pressing on the gum and seeing how long it takes for that colour to return. Next, we take the pulse using the facial artery. Don't worry too much, an awful lot of horses start chewing at this stage. So that's just under the jaw here. It's a bit difficult because it's a dark horse. It's better if you can see it on a real screen. So it's literally just under here that you can feel, but it's very difficult to feel, like really difficult. I mean, I will struggle to find the facial artery sometimes, and you can bet your bottom dollar, as soon as you've found that artery, they start chewing like that. And as soon as they do that, you've lost it. So it's good to do if you can, and if you become expert at finding a facial artery and doing that, that's brilliant, but don't worry.
They do, and don't bother doing this part.
Next, you take the heart rate. This is much more easily done if you have a stethoscope. You don't need a professional stethoscope like this. You can just get a cheap one, probably from Amazon or somewhere like that. What you do is you place the stethoscope behind the elbow, so really quite far forward. Don't be tempted to put it back here, you won't hear anything. So you push the stethoscope really.
So you should be like really in the elbow. So you've got your horse stood here, and you've got your point of your elbow there. You're really pushing it forward. What would be amazing is if your horse puts 1 foot forward. If you can get the horse to put a foot forward, it opens up that area completely, and it's on the left-hand side, and you can put your stethoscope in there. If you get a stethoscope, and this is just from a drug company, I mean, this will cost like £3 or something. That will pick up a horse's heart rate without any problem whatsoever.
Is you place the stethoscope behind the elbow, so really quite far forward. Don't be tempted to put it back here, you won't hear anything. So you push the stethoscope really quite far forward underneath the elbow. Once you've heard that familiar lub-dub of the heartbeat, you then listen.
It is incredibly easy to think lub-dub is 2. So if you listen to your horse's heart rate and you think your horse has got a heart rate of 80, but your horse is going, hi, I'm doing good here, it hasn't got a heart rate of 80. It's got a heart rate of 80, it's really sick. So you're going to go, okay, let's just maybe work out, am I double counting? It is incredibly easy to double count. So the noises do vary. So once you've done it a bit, you actually focus on one noise, because you'll pick that one thing. And you might focus on the lub or the dub, it doesn't really matter. You'll focus on that. So practicing this stuff is really important.
For at least 30 seconds. Obviously, multiply that by 2, that gives you the heart rate over a minute. Next, we listen to the lungs. The easiest way to see if a horse is breathing is to stand facing the flank, and then you can gently watch as the belly moves with the breath. Horses are very subtle breathers, so it can be quite difficult to tell. So just spend some time just gently watching, and then your eye will pick up the movement of the belly.
Now, the other thing which is even simpler, depending on your horse, is that you stand and look at the flank, and hopefully you'll be able to see them breathe, but it's really slow. It's only like 8 to 12, so you've really got to look at them for quite some time to pick it up. And they move, and they sniff, and they chew, and all that kind of stuff. If you're going, I'm not really sure, what you can do is, you've got your horse's rib cage, you can feel the end of the rib cage, you can rest your palm on the back of the rib cage, and then you just rest your fingers on the flank, and then you'll pick it up, because your fingers will be pushed with the breath. And that's a really nice way of picking up a horse's breathing rate. If you're not sure, if you think, I'm just not quite certain here, that can pick it up nicely.
Horses only breathe at between 8 to 12 breaths per minute, so it's a very slow rate. Now we'll also take the lungs. They, again, are really quite far forward. The rib cage actually comes back to here, but the lungs themselves only really come up to this part here. So we listen in this region here, when top, middle, and bottom. Next, we're going to take the temperature. Let the horse know that you're there, and stand close to the hind leg. Don't be tempted to stand out here, and certainly don't be tempted to stand here. The closer you are, the safer you'll be. Reach over, take the tail, and move it to one side.
So this is really important. Look, if you see what I'm doing is I'm round the horse here, I'm about to pick up the tail, and I'm not looking at the tail at all. I'm looking at the horse's left hind foot. Because if you see that left hind foot start to move, you move that way. That's key. So, and people, you might know your horse really well, but never presume they're going to be okay. the times I've almost got kicked of when I've just gone into horse is fine, I don't even think about this, and I've ended up with a foot here. So just always, 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 always just think, okay, you know, you're not going to waste time by doing that. You go in, look at that hind foot, because you'll see the hind foot move. Your eyes will tell you that hind foot moves before you feel the sin. If you see the hind foot move, you just walk, and because you're close to the horse, you just step away. If you've got the horse's leg here, and you're doing what I said, whatever you do, don't do, which is going at an angle, you are where the horse is naturally going to kick. So if you go to the front, you get the occasional horse will cow kick you, but you kind of know those horses are going to cow kick you. If they're going to do a surprise kick, they kick out behind. Most horses are absolutely fine.
At this point, look at this leg to make sure that the horse is comfortable. Then insert the thermometer and then just gently angle. This is not a forceful movement, just gently angle. That means that the tip of the thermometer is touching the lining, and that means you're getting a true reading of the temperature. And the thermometer, certainly this model anyway, will beep when a stable temperature has been reached, which takes a long time. If you don't allow the thermometer to reach a stable temperature, your reading will be inaccurate. If you hear that beep now, it's now beeped. Gently withdraw the thermometer, let go of the tail, and step forward away from the horse. And now you have a temperature.
So now you should be able to hopefully provide a heart rate, a breathing rate, and a temperature when you call the vet, which is really handy. We can tell you an awful lot that's going on. We can reassure you, or we can say, look, okay, that's serious. That's something we need to either see or talk about or whatever. So knowing how to take your heart rate, your respiratory rate, and your temperature would be amazing if all of our clients could do that. That would be fantastic. Now, digital pulses. Digital pulses, what do they do? We also, has my horse got a digital pulse? Well, they've always got a digital pulse, otherwise the feet would fall off, because it means they've got blood going to their feet, right? So they always have a digital pulse. But you can't pick them up very easily at all unless there's a problem. And then you should be able to pick them up. So when we say has the horse got a digital pulse, what we should technically really be saying is, has my horse got an increased digital pulse? But we all say the same thing. They're difficult to find, and the reason they're difficult to find is that no one can teach you the pressure you need to feel the artery, because it's impossible to teach. You have to practice enough so you know that you're not, because if you press too hard, then you occlude the artery. So if they've only got mild digital pulse, you just won't feel anything. If you don't press hard enough, you won't feel anything either. So there's that happy medium which no one can teach you. You just have to practice, know where the digital arteries are, which I'm going to show you another video, which will show you exactly where they are. And then you just practice and practice. If you are ever unfortunate to have a laminitic pony, or if you've got a friend who's ever had a laminitic pony, and I think we need to face it, there's an awful lot of laminitic ponies out there, you maybe want to just say, can I try and feel the digital pulses? Because then they're much more obvious. And you're learning from, which is a pretty sad situation, but it's a very useful thing to be able to do. And once you've got the confidence that you know where those digital pulses are, that's great. You know where they are, so they don't move. So they're always going to be in the same place, all right?
This is how to take a digital pulse on a horse, which is extremely useful, but it is quite tricky to do. Run your hand down the back of the horse's leg, just to let him know that you're here, and he gets used to it. Because an awful lot of horses who've been very well trained will pick up their leg automatically, which is what you don't want them to do. Good boy. Then, pick up what are known as the branches of the suspensory ligament, which are these two hard cords in the middle of the back of the lower leg. Run those, your middle finger and your thumb down the cord until you get to the widest part of the fetlock. And then gently either rotate your thumb and finger through 90 degrees or move them back gently, and you'll pick up the digital pulse. But if you squeeze too hard, you'll obliterate the vessels and you won't be able to feel it. So you just have to practice a bit to get to know exactly what kind of pressure you need. So practice on your own horse, just so you know what pressure to apply to be able to pick up that pulse. And every single foot is exactly the same. So run your fingers down, the suspensory branches, widest part of the fetlock, move back a little bit, and you'll pick that pulse up really quite nicely.
super simple, but very difficult. But just practice, practice, practice. That, again, would be amazing. So again, so another thing is really, what is an emergency? It's quite difficult, right? I mean, we've got a horse who might be ill. We're all very close to our horses. So it's very easy to think that you have a genuine emergency when you might not have an emergency. And some people obviously think they don't have an emergency when they do have an emergency. So yeah, what is well, an emergency is now. Right, that's an emergency. Today is, we're a bit worried, might get worse tomorrow, so let's see it today so it doesn't get worse tomorrow. But that's not actually technically an emergency. Tomorrow is definitely not an emergency. This week is nowhere near an emergency. And this month, you can see it in 6 months' time, horse is absolutely fine. Okay, so an emergency is now. And another way of thinking about it is, if my horse is behaving the way it is now, and it were me, which I know is slightly difficult to do, would I take myself straight to A&E and call an ambulance? But that's what you're doing when you're saying, you know, you're dialing our number and you want us there and then. You can always dial the number, but that's what you want to, and we'll always answer and we'll always give you any advice you want. That's not the point. The point is just trying to get a handle on, is this a real emergency? Do I really need to worry here? I must pick up the phone, or I must talk to my parents, or I've got to get someone here now, okay? So there are certain things which fall into this, we've got to see this horse now. Eyes, you might not necessarily need to see the horse now with eyes, but eyes deteriorate incredibly quickly. So you should always make the call. If your horse has got a bad eye, always call. And we might ask you a few questions, and we might go, okay, we're happy with that. You can either self-treat if we think that's appropriate, or we'll see you later today, or we'll see you tomorrow, or whatever. But please don't presume that the eye is okay, because there are certain things you need to, I could do an entire talk on eyes. Okay, that's not what this tonight's about. Okay, so tonight is just trying to, as I say, doing the brief thing. So eyes are really important. Always pick up the phone. We're here for that anyway, but always pick up the phone and we'll just talk you through it, and we'll either basically take the decision as to whether your horse's eye needs seeing into someone else's hands. Don't take it into your own hands. Okay, so eyes are really important. Colic is the obvious one. You know, most people would always cause for colic. There are different signs for colic. We do get onto that later, so I'll go through that later. Wounds, it does depend on the wounds, and there's a little bit of common sense. So, you know, horses get every kind of wound that we would get. So they get a graze. Well, that's not a problem. And they can get massive wounds, which are obviously a huge problem. And then we've got everything in between. And some tiny, tiny wounds actually are the most dangerous of all. So again, wounds, if your horse has got a wound and you're not 100%, or even if you're slightly unsure, you pick up the phone. That's what we're here for. We'll talk you through the wound. And we'll come out if you want us to. Obviously, we always come out if you want us to. But we might go, okay, well, we don't need to do that. You can do this or that. We'll monitor that. Or we go, yes, we need to be there now. And we will get to you as quickly as we possibly can. Infections, so that's really a horse with a high temperature. That's your classic infection. They can be dealt with at home quite commonly. But nevertheless, if your horse has got a high temperature, you should call the vet. Again, take the decision as to whether you need to call, or take the decision as to whether your horse needs seeing out of your own hands if your horse has a high temperature. So that's more than 38.3 or certainly 38.5 degrees C. And lungs as well. If you can really see your horse breathing hard, there is a serious problem. You should not really be able to see your horse breathe. It should be quite difficult to do. And if you're going, oh yes, if your horse is heaving, as we call it, that's a problem. Please pick up the phone. So eyes. What do we need to think about when we're looking at eyes? So with all of these things, there's a massive scale, isn't there? So you've got a horse's eye that is barely causing any problem at all, and you've got a horse's eye that is causing an immense problem, and that's fairly obvious. One of the best ways, a closed eye is obvious, isn't it? So if your horse is stood there like that, it's got a problem with its eye. We don't really need to discuss that. You're going to call the vet anyway, aren't you? So that's fine. So we've got a closed eye. That's really easy, actually. It might be more difficult for us because we've got to try and open the eye and have a look. But from a decision-making perspective, closed eye, you're just going to pick up the phone. But what if you've got a horse that you're not quite sure whether its eye is painful or not? It's sort of blinking a bit and you're not really sure. So what you need to do there is you need to look at your horse's head in front of you, and you need to look at the eyelashes. So in a normal horse, these are the eyelashes. Horse's head, yeah. You've got eyelashes, and they're at the same angle. They can be different angles, doesn't matter the angle, but they'll be the same angle. If the horse's eye is painful on, say, this left side, the eyelashes will do that. The eyelashes will tilt. So if you look at the horse, and you've got one horse's eyelash, one eye's eyelash doing that, and the other eyelash doing that, your horse has got a painful eye. So you call the vet. A clear cornea, that's another obvious thing. Okay, so if your horse has got a bright, clear eye, that's good. If it's cloudy, that is obviously really bad, isn't it? We don't need to think about that again. That's a serious problem. It doesn't mean it's a serious sign. Some cloudiness is fine. Some cloudiness we don't need to worry about, actually. It'll be fine. But some cloudiness is incredibly difficult, and we need to react. Tearing is another thing. Horses tear quite a lot as well. So that's another thing for looking at this eyelash angle. If your horse is tearing down one eye, and you're going, is my horse painful? Is that something I should maybe worry about? Now you know, you're going to look at your horse or your pony, and you're going to go, well, the right eye is tearing, so I'm going to look at the horse, and I'm going to look at the eyelash angle. If the eyelash angle is staring at me beautifully like that, I don't need to worry so much. You might call us, but you don't need to worry. If that eyelash is tilted down, it's definitely painful. It's tearing because there's a problem. You need to call, okay? I think we're now going to see some horrible pictures. They're not that horrible. All the horses that you've seen here were fine, okay? They were all fine. Things look bad, but I think I need to show you some stuff, don't I? So, bright eye, this eye's open, looking at us fine. Horse is okay. Obviously, that's a bad eye. So we need to worry about that. All that is conjunctivitis. Wow. Okay, that's all that is. There's nothing else other than conjunctivitis. But he's got massive edema, so there's huge amounts of fluid, and it's all pushed out, and it looks absolutely horrendous. I'm not worried about that eye at all. So that's, well, we need to treat it, but we're okay. And of course, I'm merrily going on about eyelash angle, but you have no idea what the eyelash angle's doing there at all. Is incredibly serious. So you've got a cloudy cornea. You can see there's a hole. If you can see a hole in your horse's cornea, that is an incredibly serious thing. This is what's known as a melting ulcer. Eyes are very, very good at healing because there's a big blood supply and they're designed to heal because they're on the outside and all that kind of stuff. But because they're good at healing, they're kind of reactive, really. So if things go wrong, they go wrong incredibly quickly. And this horse will lose its eye within hours unless we get onto that and treat that incredibly quickly. So that's just a horse was fine, horse didn't lose its eye, horse is okay. And there's something that I don't, this green, that's me, that's not me, that's dye I've put in the horse's eye, okay, so that's fine, we don't need to worry about that. But that's a cloudy eye, okay? There is pathology in here, okay, so these kind of little holes here aren't normal, but this horse will be pretty comfortable. This is something we wouldn't be worried about. That's cloudy, extraordinarily worried. That's cloudy, not so worried. But you don't make that decision. Don't make that decision. We need to make the decision because that's what we're supposed to do. I'm just trying to demonstrate that, when you've got an emergency, you're automatically going to be really worried, right? Which we all understand, but always try and bear in mind that it might be absolutely fine. Horse might be fine. Might need a bit of help, but it might be fine. So just because it's an emergency isn't going to be something we need to worry too much about. We understand that you're going to be really upset, but always try and have it in the back of your mind that you're not going to lose your horse or anything like that. Everything might be all right. It might just look bad. So colic. What are the signs of colic? All colic is abdominal pain. It's a bellyache. That is all colic. The colic does not mean anything else. It means you have a sore tummy. So you can have anything from a sore tummy. So you've just overeaten and you've got a sore tummy through to what we call surgical colics, which are the serious colics, and everything in between. There's no definition of colic other than belly pain. That's all that means. So they can be off their feet, they can be pawing the ground, they can stretch as though if they look to urinate. So if your horse is stretching out looking to urinate, it's because it's got abdominal pain 99% of the time. It's not straining to urinate, it's stretching out its abdomen, which makes you think as though it's straining to urinate. If there was a problem with it urinating, it wouldn't be doing that for very long. Problems with your urinary system lead to incredibly serious problems incredibly quickly. They don't last for days or hours. This is a totally different ballgame. So if you think your horse is constantly trying to urinate, it's got colic. Flank watching, so just turning around looking at its belly. Horses that shouldn't do that. If they're doing that, that's colic. And then there's the obvious ones. If they're rolling, that's serious. And if they're rolling and sweating, that's very serious. But the more you see of colic, I've seen quite a lot of colic, the more grey all of this area is. I've had horses that need surgical colic that are just off their feet, and I've had horses who've been rolling around, destroying their stable, sweating, that I've given a little bit of painkiller to, benched to their feet, and we're absolutely fine. So again, just have it in the back of your mind, just because your horse is rolling in the box, yes, that's bad, you call the vet, but it doesn't mean that you might lose your horse. But equally, if your horse is off its feed, and it's been off its feed all day, call the vet, or now you're going to take its heart rate. You take its heart rate, and its heart rate's 60, you know, that's no. If its heart rate's 40, you can relax a bit. You're still going to call, but you've taken its heart rate, you can relax a bit. This isn't our video, I've stolen this video. But it's a good video for showing different bits of colic.
So what are the signs of colic? Horses with colic typically paw the ground and they become distracted, they sort of flank watch, they can roll on the ground, and they can show a whole lot of signs of abdominal pain. So this horse here in the picture is having a look round at his flank and he's trying to tell the owner that he's got a painful abdomen. Horses with more severe types of colic may be rolling on the ground and you may not even be able to stop them. This is another young horse showing signs of colic, and he's in the hospital with a drip tube attached, but he's pawing the ground continuously and is in a considerable degree of pain. And this is another horse in the hospital.
So I think that's quite interesting. So that horse you just saw is in a lot of pain. You wouldn't really think that. You would think the horse that's rolling is the one. I don't know what the heart rate of that horse is. I wouldn't be surprised that heart rate of that horse is anywhere between 80 and 100.
Who's actually trying to roll on the ground, and this is despite administration of painkillers. This horse is quite painful and is trying to get down and roll, but we're not letting him do that because we're going to take him into surgery to try and help him out.
He then goes on to what I've just told you, so there's no point in listening to that. That just kind of shows you the various signs that colic do. I think it's quite a neat thing for you to sort of have so you can kind of see what we mean by colic or what it means. The wounds. We're all going to experience, everyone who's got a horse is going to experience a wound at some point. This is a classic horse that's gone down on the road and has got a wound there. Now, the things that you need to worry about with wounds are, as I said earlier, big wounds are obvious, right? And we don't need to talk about big wounds. Big wounds you're going to call us, that's fine. A small graze is also absolutely fine, provided your horse is sound. If you've got a small graze near a joint and your horse is lame, for all you know, the graze isn't just a graze, there's a puncture in there or something's gone on. So if your horse is lame with a wound, you need to call us. So that's fine. If the horse has got a wound near a joint, so you've got the knee or the carpus, you've got the fetlock, you've got the pastern, you've got the coffin joint here. Technically, you can get into the coffin joint with a wound. Very difficult to do, but you can do it. You've got the hock behind, and you've got the stifle, and you have got the elbow as well. The higher the joint is, the more difficult it is to get into. It can happen, but it's difficult. These lower down ones are much easier to get into. So if you've got a wound near a joint, please always call. We'll just ask you a few questions. We might just monitor it, but we might say something really important like, please don't give your horse bute. Because a lot of people just give their horse bute, and then they have a sound horse that's actually disguising the fact that it's got a septic joint, so it's got infection in its joint, and we get to know that too late. So if your horse has got a wound, unless you are absolutely certain, please don't give it any bute, just call us. And we might then just go, oh, just give it some bute. But it's generally a good idea just to let us talk through the wound so you kind of know. Now this horse here is fine. So one of the nice things about horses is nature's pretty cunning, really. So there's a big old tendon runs down the front of your knee here, called the extensor tendon, basically. So what this tendon here does is it actually lifts the toe. But what it does is it protects the knee joint. Because horses go down on the knees all the time. If a horse is going to collapse or do anything, it's going to go down on its knees. So Mother Nature's protected the knee joint. So it's pretty difficult to get into your knee joint because there's a massive tendon in front, and that's protected it. But you still don't just go, oh, it's fine. But you know, the knee is not a bad joint to have a wound here. Round the back, very, very different. No protection here at all. And hocks don't have much protection either. But they've got much smaller joints, and they're in slightly different places to where people think they are. So normally they've missed. But nevertheless, if you think my horse has got a wound near a joint, you're going to call the vet. So infections. Well, I mean, you get bacterial infections, you get viral infections. It is impossible to tell normally whether they're viral or bacterial. You can try and do various tests, but to be honest with you, you don't really know. So we're just going to call them infections, okay? They're normally off their food, and they're off their food because they've normally got a temperature over 38.3. If we have a temperature, I'm going a bit off script here. I don't quite know what our temperature, it should be 37. I'm not sure if it's 37 dead or 37 something. But anyway, let's just say we had a temperature equivalent to 38.5, we would be bedridden. Having a temperature makes you feel horrendous. Now horses are, because they're animals, well, we're animals as well, before my son jumps in and says, we're an animal too. But they're not as domesticated, say, as us, so they won't show this kind of stuff. Okay, they're not going to go to bed when they've got a temperature. They're going to try and show nature that nothing here is going on. So they won't do that, but we would be in bed with a temperature. The heart rate is generally over 40, but it's generally under 60. It's normally about 50. So if I listen to a horse's heart, I don't take the temperature before I do the heart rate. If I listen to a horse's heart rate and it's 50, I start having an internal bet with myself what the temperature is going to be when I put the thermometer in. It's normally way over 38.5. Increased breathing rates is going to be above 12, normally about 24. It's very rarely going to be higher than that. If it's higher than that, you've probably got quite a serious temperature and your heart rate might have crept to 60 or above sometimes. Horses depressed, so they've got their head on the floor if they're really depressed, or they're just standing there looking depressed. And then you may have some swellings and pain. So then this affects the limbs really, so the legs. So if the leg's swollen and it's painful, and you've got a heart rate, that is an incredibly serious thing. That's a disease called cellulitis. There's a subset of that called lymphangitis. That's pretty rare, the lymphangitis, but that's a technical thing. But pain is everything. So if you look at your horse and it's got a swollen leg, and you can go to your horse's leg and squeeze it hard and the horse doesn't do anything at all, it's not infected. If it's a little bit swollen and you squeeze it and it's painful, it is infected. If it's huge and you squeeze it and it's painful, it's infected. That's categorical. It's infected. We need to jump onto that. There are tiny subsets where that is not true, but I have to do broad brush things. Okay, there's lots of different things that it might be, but I think it's generally good just to get the general idea. Pain means infection. Pus is an obvious one, right? If you've got pus, you've got infection. If it's coming out the nose, which hopefully this is going to show you, there we go. We've got an infection. How important that infection is has got very little to do with the colour of that, possibly a little bit to do with the volume of that, But the important thing there is how bright the horse is, what its temperature is, what its breathing rate is, what its heart rate is. That tells you the importance of the infection. The disease this horse might have could be more important, but I'm not going anywhere near that tonight. Lungs. So breathing rate, 12. Have they got a cough? What's the cough like? Is it a deep cough? Is it a throaty cough? They're quite important things for us to know. How often is it coughing? Is it coughing all the time? Is it only coughing when it's being fed? Is it only coughing when you're being exercised? If it's literally stood in the yard and you can hear it coughing, it's been coughing all day, that's a serious problem. Nasal discharge, so has it got a snotty nose? Abdominal effort, heaves as we call it. Again, we now all know how we're going to look at that and feel that. Is your horse literally breathing out? I've got a video of that. Flared nostrils, that's a big thing. You very rarely get flared nostrils without heaves. So if you go and look in your horse's stable and its nostrils are flaring, we know we've got an immediate problem. Yeah, so that's your flared nostrils. And then you can see your abdominal heave there. But if your horse is doing that, we've got a major serious problem here. There's your abdominal heave. You can see that. See, and what that means is it's using its stomach muscles here, so its stomach muscles there, to force air out of its lungs. And here it's using everything. It's pulling its lungs out, it's heat. So this horse is in what we call acute respiratory distress. You're obviously going to call the vet at that point. Horse is fine. Is my horse lame? That is sometimes really obvious, but a lot of people don't know how to, quite understandably, how to know whether their horse is lame. People get obsessed with what the feet are doing. I'm going to show you what to do. Ignore the legs, ignore the feet. Completely ignore them. Then they might tell you something very subtle, but they're not going to tell you whether your horse is lame. So when you're looking at your horse, you're not looking at the legs, you're not looking at the feet at all. Trot is where you want to be seeing everything, unless your horse is obviously lame at the walk. If your horse is obviously lame at the walk, you're not going to trot it, but we don't need to worry about that. If your horse is lame at the walk, we all know that. You're going to call the vet. That's fine. We're trying to work out, well, is my horse lame or not? So what do we look for? So in the forelimbs, so the front legs, all you need to look at are the ears. You look at the tips of the ears. That's all you look at. Don't look at anything else. Just look at the tips of the ears, okay? In the hind leg, all you're going to look at is the pelvis. That's it. Ignore everything, because if your eye gets drawn down to the legs, you'll see nothing. It doesn't tell you anything. So you're just looking at the pelvis with the horse going away from you. And then when you're looking at the ears, it's when the horse is coming towards you. So you always should trot the horse away from you and towards you. For some reason, it's got into sort of lingo that you walk a horse away and trot it back. I have no idea where that's come from. It's not helpful at all. You either walk there and back, and you trot there and back. You need the same gait going back and forth, not a different gait, because they tell you different things, okay? So if you're not sure, you're going to trot your horse, you're going to get someone to trot your horse away from you, and you get someone to trot the horse back towards you. And you're going to look at the pelvis going away, ignoring everything else, including the ears, because otherwise you lose what you're trying to do. So you're looking at the pelvis going away. When the horse turns around and comes back, you look at the ears, okay? Non-weight-bearing lameness, now what that means, technically, is your horse can't put any weight on that leg. It is a fantastically rare lameness. Because what that actually means is the horse will never put any weight on it, so it will hop. It won't be severely lame. A non-weight-bearing lameness is they will not put any weight through that leg at all. So that is a very small technical subset of lameness, actually. Most people don't have a non-weight-bearing lameness. Most people have a very severe lameness where the horse doesn't want to put weight on the foot, but will put enough just to move themselves, or they'll move it if you turn the horse one way or the other. That is a severe lameness, but it's not non-weight-bearing. So if you ever have a pub quiz, I can't imagine anyone ever asking that, but if you ever have a pub quiz, you now know what the answer to that is. And then, do I bring my horse into the stable? Yes, absolutely, every single time. We can do nothing in the field. I can't bandage the horse in the field. I can't clean the horse in the field. I can't examine the horse in the field. If they've got a wound and they're severely lame in the field and you're kind of worried, you're probably not going to bring it in, but we're going to have to bring it in anyway, but you might call. Okay, you might call and go, what do I do? Even a horse who's got a horrible injury to its leg, we have to move it. We can't stay in the field. We have to move it. They will hop quite happily in to the yard if they need to. They will move. If they're not non-weight bearing and they've just got a severe lameness, you have to get them in. All you're doing by keeping your horse out in the field is delaying everything, because what the vet then has to do is get there before they can do anything. We have to bring the horse in. And that actually technically means that the horse is suffering for a bit longer than it needs to be, because we're spending time getting the horse into where we need to get it. So you don't have to get it into the stable if you don't have a stable, but you want to get it to the edge of the field, near the gate. Because if we need to do something, that's where we're going to be doing everything. We can't do anything in the field. Call if you're worried, always call. No one's going to always call if you're worried, but generally speaking, you're just going to get the horse in. I can't think of any occasion in my career where I haven't managed to get the horse to where I needed it to get to. The occasional one, but really the ones that we couldn't get in, yeah, that was a bad situation. And you weren't going to make anything worse by getting the horse in that situation anyway. You can't make the lameness worse by bringing the horse in, is what I'm actually trying to say. But if you get the horse in, we can do stuff. We can't do anything out in the field. So, because all I want to do here, this is just telling you how to safely trot up a horse, which is quite good. You can sort of see what's happened. All I want to do is show you what you're looking for. Going away, you're looking at the pelvis, okay? And when it's coming towards you, you're just looking at those ears. That is all you are doing, looking at the ears. Let's just listen to me prattle on, because
This allows the horse's head to move freely while still being short enough to control the horse.
if you notice, the rope is looped so that your fingers cannot be trapped, and there's also a knot at the end of that rope. So when the horse pulls away, if it does, you've still got the horse and the rope can't be pulled through your hand. That just makes everything as safe. If you've got a horse, really, I know I'm now teaching people to suck eggs, and I apologise for that, but if you're trotting a horse up for us, you want to wear gloves. Okay, just wear gloves, because rope burns horrendous. I get rope burns all the time, horrendous bloody things. So just don't get a rope burn, right? You want a foot between the horse's head collar or the bridle, whatever. You might ask us why, but a foot. And when you're on a foot, because you want the horse to be able to move its head, but you don't want it to be going all over the place. You want control of the horse. You want a foot where you're holding it. It's to one side, always. So you're to one side of your horse. You're not in front of the horse, because I can't see anything then. So you're to one side, and you just drop the horse up beautifully in a straight line. These things are so difficult, I know that, okay? That's what we're trying to achieve. But then you have when I've seen this all the time, okay, and it scares the living daylights out of me, people loop the rope round their hands. And you can imagine the number of horses we have trotting up here. They can be the quietest horse in the world. But trust me, if something happens out of the blue, the horse can suddenly go, ooh, I don't like that. If you've got it looped around your hand, you can break your fingers. So just don't have it looped around your hand, and have a knot in your head collar, because if you do, you've got the loop, it pulls out, you've still got the knot, and you might have enough to keep your horse. Obviously, don't get pulled off your feet, okay? So that's not what that's for. It's just to give you that final bit where you might be able to hold the horse, okay? It's something that we see all the time, and we feel bad on site saying, can you, because that's sort of feels like you're sort of, again, teaching people to suck eggs or whatever. So we don't really want to do that. But for you guys, please don't loop it round your hand. Please don't do that. Honestly, we have had, I've seen it, injuries, and it's not nice. Okay, so, and wear gloves. I don't wear gloves. I mean, I don't wear gloves because I'm silly. But everyone who trots a horse up here, for me, the nurses do it here, obviously, they wear gloves, and they wear gloves, so you get rope burns. They're deeply unpleasant things. Very commonly, we need to assess a horse on the hard circle to see if that exacerbates any lameness that the horse may have. When a horse is turned on a hard circle, different parts of the limb are either compressed or extended, which might mean that the horse shows more obvious gait abnormality. Firstly, we look at the horse when he is walked, and then we put him into trot, and we see what he is like when he moves at a faster gait. So now we're just looking, so we just concentrate on one side first. So we assess one rein. We will then put the horse on the other rein, see if there's a difference. So you're just looking at the ears in front.
We also like to assess the horse
And you're just looking at the pelvis behind.
Surface. This too can exasperate different types of lameness. Sometimes the horses are actually sound when walked.
So what are we looking for? So you've got that horse going around in a circle, and all you're doing is you're going to look for the front, the forelimb. Is my horse lame in front? You're looking at the ears. Literally just focus on those ears. And as you look at the ears, don't look at anything else. Look at the ears. If the horse is lame, the ears will start moving up. And they'll do it regularly. They won't go up, 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 because horses move their heads all the time, right? But you'll be looking at them and they'll go up. And if you notice a rhythm, then what you have to do is then when the horse's ears go up, look down and we'll see which foot is on the ground. And then do it again. Up, look down. Up, look down. And then you should, as the ears go up, the lame leg is on the floor. That is how you tell whether your horse is lame in front. Don't worry about feet and what they're doing and foot flight and all that kind of stuff. That's all very interesting and it's very useful and it's stuff we use for sure. But for you guys, is my horse lame in front? You're going to look at the ears. Same when they're going to trot. They're coming towards you and you're looking at those ears and they're going up, up, up. And as soon as that ear, because then you've seen the pattern, right? You've gone up, up, and you know it's going to go up. It goes up, and you look at the foot. Up, look at the foot. And you then see which leg it's lame on. Don't worry if you can't tell which leg it is. That doesn't matter. But if your horse is moving its head rhythmically as it's coming towards you, your horse is lame in front. Now, the pelvis is much more difficult, okay? Because the ears are simple, right? You've got two sticky up things that you can look at. Now you've got a flat surface that you're now trying to do actually exactly the same thing. Right, horse's pelvis is here, right? This is your back end of your horse here, okay? So you're looking at the back end, and when the lame leg hits the floor, it's going to be this leg, it does that. What it technically does is that and that. So what happens is the movement on the lame side is greater than the movement on the non-lame side. Now, actually, some people, and I pick up the dip. That's what I pick up. I pick the dip up. I can see the dip is more exaggerated. Other people pick up the hike. Is more. It doesn't matter which one you do. It's irrelevant. It's the movement. And if it was this leg, that would be more difficult for me to do. This moves more than that. That will tell you if your horse is lame or not. It becomes much more difficult when the horse is on a circle because actually the pelvis is naturally tilted like that. And then you somehow have to work that out. That's where we kind of come in. And if you see it a lot, that's where you'll see. You can see that kind of stuff and you get to know that. But that will tell you everything, is just look at that. Imagine a metronome. You've got your horse and you're a metronome. I'm sure we all know, it's a rhythm. And you're looking at the pelvis and it should literally be like a metronome. Bum, 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 bum. And if it's not a metronome, it's lame. It's simple as that. Okay? Right. So a bit of blood goes a long way. Blood is wonderful stuff. We all get very excited about blood. Vets love blood. If we didn't love blood, we wouldn't do the job we do. So how much blood has your horse got? It's got about 9% of his body weight. So your standard horse is 500 kilograms, so it's got about 45 litres of blood. That is a huge amount of blood. How much can your horse afford to lose? Now that depends on how quickly he loses it. But he could probably use 20% and be okay. That's 9 litres. That's an entire bucket of blood. And I think it's a really good idea, fill a bucket, not with blood, fill a bucket with water and put red dye in it. Go to your sand school, not a black one, go to, with sand, and pour that on your sand surface and just see how much blood that is. It is a huge amount of blood. So most of the time, you haven't got any problems at all. Your horse has got a bleed and we don't need to worry about it at all. So the one thing with blood is try not to panic. Okay, that's the thing. Don't panic when you see blood, and there's blood all over the walls. I'm going to show you a picture. You don't need to worry about that. You're going to call us, but don't worry about it, okay? You will know if your horse is in trouble when it's bleeding, okay? They'll faint and all that kind of stuff. So, and that's incredibly rare, incredibly rare. The body is incredibly good at stopping that. Arteries versus veins. People get wildly worried about arteries. Veins are more important. Arteries are designed to stop bleeding because they've got muscle in their wall and they contract and they stop. Unless you've got a very big artery, but that's very difficult to achieve. So the most common ones are down in the pastern. They get wounds there and the blood is pumping and everybody's panicking, totally understandably. It's just literally nothing to worry about. You need to call us. That doesn't mean don't call us but don't panic. I'm going to tell you what you need to do in that scenario, but don't panic. It's all right. Veins aren't designed to stop bleeding. Not like an artery anyway. You get way more worried about venous bleeds because they'll just keep going. Slowly, but they don't stop. So we're more worried about veins than we are arteries, generally speaking. Nosebleeds, really common. 99.99. Can't get another point, can you? 99.99999 are nothing to worry about whatsoever. They're incredibly difficult to work out what's going on. If your horse got a nosebleed, please do call. Generally speaking, nothing to worry about. There are certainly some certain very rare conditions that it's very important, but generally speaking, there's nothing to worry about. Wounds, again, they're going to be arteries versus veins. We generally don't need to worry about the blood associated with wounds. There are different things that we need to worry about rather than the blood. Now, if you walked into your stable and you saw that, everyone would be really quite worried. That's probably lost a litre of blood. Do you imagine? And if you don't, people don't believe. If you don't believe me, get your bucket of water with your dye in, get a sponge, and start wiping a white wall with your litre of blood, and you'll just see how far this stuff goes. So you can have some fun this weekend. Maybe ask your parents before you do all of this stuff. Sorry if I've but it's just to reassure you. And what's really useful, and it's very, very difficult to do because you have to see enough blood and bleeds and stuff, is if you can estimate how much blood your horse has lost, that's a fantastic, useful thing to be able to do. But that's a bit difficult, really, to be fair. So bandaging. This is probably what everyone thought First Aid was about, right? You're very rarely going to be bandaging anything. Certainly not without veterinary supervision. Unless it's a stable bandage. Yeah, I'm talking about bandaging a problem here, okay, like a wound or something like that. Because if you get a bandage wrong, you will cause more problems than you started with. They are not something to go about lightly. They are not something to do without knowing exactly what you're doing. And they are not something that you go onto Amazon and you buy all your bandage stuff because when your horse has got a wound, you're going to bandage the leg. You will create problems if you do that. Horse's skin is very sensitive. It is incredibly easily damaged, and you will end up with what we call a pressure sore incredibly quickly, within hours sometimes, and the pressure sore can be way worse than the thing you started with. Even us as professionals will get pressure sores on horses that we have bandaged. It happens. So you've got to be very, very careful. And as I say, if you're thinking you're going to bandage a wound, my advice is please don't bandage that wound. Call us first. Any wound that needs bandaging, you should not have put the bandage on. We should have put the bandage on, really. And then we might show you what to do. That's fine. So it's not like we always have to put the bandage on. No. But we should show you how to put the bandage on. So when do you bandage? When the vet tells you to bandage. At no other time should you really be bandaging anything on your horse. If your vet is saying, I'm going to put a bandage on, and are you happy to change the bandage? Here's what you do. Great, perfect. But please don't just put. We go out and see bandages, and we think, luckily we're here in time, type thing. When do you not bandage? Really quite a lot of the time, actually. It's not like us. Yeah, if you get a wound above the knee or the carpus and you get a wound above the hock, there is nothing you can do about that bandage-wise. You can try, but it will fail. There's no point doing that. You can't bandage the head. You can sort of try, but... So you can. You can bandage the head. Luckily, my son is here. It's difficult to do. You can't really bandage the head. You can do an abdominal bandage. So technically you can bandage the abdomen. That's a very tricky thing to do, and that definitely needs veterinary supervision, and you kind of need a special thing anyway. So bandaging is not what first aid is about. Apologies to those who thought I was going to tell you all about bandaging. How do you keep it on? And that's the difficult bit, right? That's why they're not easy, and that's why you shouldn't do it. Because to keep the bandage on, you have to have enough pressure on so it stays on, but if you put too much pressure on, you'll cause a pressure sore, or we have had this sadly in this practice, you will cut off the blood supply to the limb, and that is not good news. So keeping it on is, yes, you need enough pressure, and you need to do certain things. So you're trying to stop bandages slipping and all that kind of stuff, so the bandages need to be long enough, etc. But be very, very careful. The one thing you can do, and is really useful to do, is poulticing. Everyone should be able to poultice a horse's foot. It's a brilliant thing to be able to do. You can do that without veterinary supervision. Okay, everyone can poultice foot, provided you do it carefully and provided you do a couple of things. I've had bandages, poultice have been put on in badly, and that's not good either. So I'm now going to show you a video. I'm quite fond of these videos of how to bandage the foot, okay? Because it's much easier to watch these things than me try and describe it.
This shows you how to put a poultice on a horse's foot. We put poultices on really to try and draw things. An abscess is the most classic. We do sometimes put poultices on to try and draw a bruise, but whether it actually helps or not, we're not too certain. It probably just provides a bit of cushioning to make the horse more comfortable. But they're really important things to put on. And you have to put them on quite carefully. If you put the bandage on too tightly, you can cut off the blood supply to the foot, which is really not very good. And if they're on too loose, they just come off. So I'm just going to show you how we put it on here. First, you soak the poultice in warm water, and then you'll see there are two sides. There's a shiny side with plastic and a dull side. It's the dull side that goes next to the horse's hoof. Pick up the foot. As you put the poultice on the sole of the foot, hold that poultice on with your thumb, and then you can trap the vet wrap under your thumb as well, and then wrap the vet wrap around. That then traps it.
The problem is when obviously I do a lot of this stuff, right? So I will skip what might be a vital step. I haven't said what is vital there. What you've now got to watch is what I do with that vet wrap. I am not getting that vet wrap and I am doing that. If you see what I'm doing, I'm unrolling the vet wrap and then putting it on. Vet wrap's stretchy. If you do that and you get it round the horse's pastern, you'll cut off its blood supply actually. So there were two things. I hope I actually say it, but the first is don't wrap it like that. You're pulling the vet wrap, you're unrolling it a bit, and then you're basically, and this is a practice thing, putting enough pressure on so you've got enough for it to stay on, but not too much. And the other thing is if you always have a bit of that vet wrap on the hoof, you're not going to over tighten it actually. So what you're trying to achieve is having the front of the poultice, if you've got it absolutely spot on, which is difficult to do because obviously you've got the horse's legs upside down, the horse is going to be moving and all that kind of stuff, okay? The front of with the hoof, can you just grab me the half leg? Perfect. This is my very helpful assistant who has given me a charger because I've forgot my charger, who has given me a speaker because I forgot my speaker. Thank you very much. Right, horse's foot, okay? The bandage, the front of the bandage should, if you've got it absolutely spot on, should never go above that point. It should always be on the hoof. And then it goes round, and because it's got to stay on, you can't bandage it like that, it'll just fall straight off. So what you've got to do is you've got to bandage it and come up over the heel and around. So coming up over the heel keeps it in position, But what you don't want to be doing is wrapping it around there with your vet wrap. If you put pressure around there, you will cut off the blood supply to the foot. It is difficult to do, so don't worry too much, but I have seen it. It's difficult to do, but if you always keep it there, you're fine. And if you just go over a little bit, all you've got to do is put your finger down there, and if you put your finger in and if you've got a gap, you can relax. Doesn't matter. Okay?
Wraps it. Then wrap it around the heels. It's very important to wrap it around the heels. This holds that bandage on. And then you simply wrap the bandage overlapping around the foot. And keep going until you use all of the vet. Then, at the end, wrap it around the edge of the sole, because this is where you get most wear of the bandage. So you want this part of the bandage to be as thick as possible. What you must be very careful of is not putting it tightly over this part here. To further protect the poultice, what you can then do is use some elephant tape. This is the easiest way of doing it, where you lay out strips of the tape overlapping to provide you with a flat bandage. Pick up the foot again, place that over the sole of the foot, and then simply wrap it round and stick it down. This horse has got a lot of feather, which is why it's getting stuck there, but that's absolutely fine. It's not particularly neat, but it is extremely effective.
Now, those of you who've ever seen me do that, I don't do that. I don't like doing it.
How to put a poultice on.
I just wrap it around with a vet wrap because you can get more and more around the edge by doing that, which I find better. But that's much easier to do. So probably for you guys, I mean, by all means do whatever you want to do, but it's probably easier for you to do the thing I showed you there, which is put a flat bit on, and that's that. Right, your first aid kit. Everyone should have a first aid kit, and everyone should have everything that is on here in their first aid kit. It's not expensive. Thermometer, your stethoscope, vet wrap, a non-stick dressing, so that's with the plastic on the back, cotton wool, duct tape. Now, I've put Sudocrem there. That just kind of means some kind of benign cream. There's loads of creams out there, but Sudocrem is pretty good for most stuff. Scissors, a torch. Now, the scissors, you really want those blunt-ended ones. You don't want sharp ones. You want blunt-ended scissors. A torch, spectacularly useful, particularly if the vet's torch battery has run out. Disposable gloves, a tail bandage, hibby scrub, and your emergency contacts. Your vet, us. Now, the reason everyone's taking a photo, that's absolutely fine, please do. The reason this is being filmed is because this will be on YouTube for you, so everyone can have a link if they want it, okay? But that's what you want in there. Everyone taking a photo who needs to take a photo? Yep, cool. So, how do you manage injuries when you're out and about? When do you stop and when do you carry on? You stop if you think the horse really needs to stop, basically. You're going to carry on if you think, because it's better to carry on, right? Really, because you're back home, you can do more stuff there. You make a common sense judge. If you're not sure, you call the vet. Generally speaking, it's better to carry on, but please call if you're not sure. Who do you call? Well, it depends I suppose, really, isn't it? It's going to be, you guys are going to be your parents, right? Or you might call 999, right? If something horrible has happened, you're going to call 999, or you're going to call your vet. You know, if you guys are out and about, hacking or whatever it is, on your phones, you should really have your vet's number there, so you can just call it, and then you're fine, right? You're not trying to thrash around, trying to find it on the internet, because you haven't got signal or whatever. Just have it on your phone. Have your vet's number on the phone. The practice number, not your vet's personal mobile number, because they might not answer it. That's why. You can always call us if you want to. Personal number is fine. The practice number is always answered 24 hours a day. So just call the practice number if you need us. Useful numbers on your phone. Again, I've just really said that. And then what do you carry with you? I mean, probably you should carry your first aid kit. Really. You're not going to carry a bottle of hibby scrub around with you, and a big roll of cotton wool and But you're going to carry a few bits and pieces, right? You don't need your thermometer, you don't need your stethoscope, but you should probably carry a few bits and pieces, just so you can do something. Right, eyes, we've already said that. Always, always, always call the vet. What we need to know, is the horse's eye painful? We now know how to do that. Is the horse's cornea clear? They're the two key questions. That's what we need to know. How do you get eye medication to a horse's eye? I'm slightly going on a bit, sorry. We're not, it's all right. Eye medication. There's the technical side of eye medication, which you should get X number of drops in the horse's eye at X hours per day. The reality is, the X hours per day matter. You just need medication in your horse's eye. Doesn't matter how much you get into the horse's eye. Don't worry about getting how much you're getting in. Get some in. You can use, if you're really struggling and it's cream, you can put it on a clean finger, clean your finger, put it on the finger and wipe it into your horse's eye. The blink spreads, you don't have to get it into the eye, you just have to get it enough so the horse's blink puts it onto the horse's eye, okay? Be careful though with bottles of medicine because they've got that pipette on them. Don't be tempted to put it like that and then try and put some in. I have had horses' eyes injured because the bottle has jabbed into the horse's eye. So what you should really do, if you can, it's all very simple me saying this, but if you can, this is difficult, this is the right eye, so I'm going to have to do this differently to the way I normally do it, but anyway, is you rest your hand on the horse's head with the bottle in this hand, you pull down the eyelid and you drop medication into the horse's eye. You're very close, but what that means is if that horse's head suddenly moves, your hand is automatically taken away. You can't damage your horse's eye at all. It's the easiest, safest thing to do. Right. Coughs and snot. Choke, we're going to do choke as the last thing, people. It's all right. So we've got choke, different coughs, as we've said. Chesty cough, is it a throaty cough? Persistent cough? Is it, when's the cough occurring if it's not persistent? Different snot, people get really, really interested in the snot. It's green, it's yellow, it's white, doesn't matter. It's got snot. It's got snot. Doesn't matter what colour it is. The snot doesn't tell you anything other than the colour, of the snot tells you nothing, okay? Don't worry about the colour. It's quite interesting to know, I suppose, but it doesn't matter. Snot is everything. Bad breathing, we've already done that, okay? Flared nostrils, heaving with the abdomen. That is really bad. And bad smell as well, okay? If your horse has got a snotty nose and you can smell it before you go into the stable, that's not good. It's not an emergency, but that means there's an infection because basically the pus is stuck within the head, the sinuses basically of the head, and it's gone off. That's what it's done. So choke. This is the final thing. So choke. People get worried about choke, rightly so. What you should have with choke is that you should have a bilateral nasal discharge, i.e. stuff's coming out of both nostrils at the same time. It's normally green because it's food, okay? So it's not normally white, it's green. So guess colour in that scenario might work, but it doesn't, so both nostrils at the same time. They're tensing the neck because they don't like it very much, and they're trying to gulp, and they look distressed because it's distressing, right? They've blocked their throat. That's really not nice. At least 90% clear within 15 minutes. Another 5% will clear within 45 minutes. So call the vet. We'll just say monitor. That's the right thing to do because you don't want to put a nasal tube down a horse's throat unless you actually have to. So it's a bad thing to put a nasal tube down a horse's throat unless you have to. So we're going to give it at least 45 minutes. And if after 45 minutes we still have these signs, we need to see the horse. At that point, it's very handy for us to know what it's just eaten and how much it's had. That's really important because then we kind of know whether we're going to be there for 10 minutes or whether we're going to be there for 4 hours. If they have had their entire evening feed, the entire lot, and they've eaten hay and they're choking, they will have filled up their entire esophagus, basically. If they've gone into the stable and they've literally taken a mouthful and choked, that's all they've choked on. Just a small amount of food. That's super simple. That's going to be really easy. So it's really handy to know how much they've actually had. Now, this horse has got choke. So the horse is very unhappy. We can see that with the eye. It's swallowing. It's tensing its neck. It's got bilateral nasal discharge of food. It's distress. It's not. This is. You can tell. This horse is a very unhappy horse, and it might have a very small amount of choke. Might be, and they try and retch and they put their head down. Looks horrible. Okay, it looks horrible. The horse is generally absolutely fine. We don't need to worry. This horse is fine. It looks horrible. It's very distressing, which is why people, understandably, when they see this, want us at their horse's side within 15 seconds, preferably. This horse could clear itself probably within 15 minutes, almost certainly within 45. The only way we can clear a choke is to pass what we call a nasogastric tube down into its throat and wash that stuff out. It doesn't go that way. It does a little bit, but most of it comes out of its nose. And if you've got, and that can cause aspiration pneumonia and do all sorts of stuff. So it's not something you just casually do. Something you might have to do, but we don't casually do it, which is why we don't do that. There you go. Thank you very much. Has anyone got any questions? I've gone on far longer than I anticipated. Sorry. So if any questions, if people want to leave because it's far too late, I'm not going to get offended. So if you want to leave, that's fine. If anyone's got any questions, any questions at all about anything?
On the poultice,
yes.
we've got a plastic bag on the floor that down and I don't need to do that anymore. So you put your animal insects on, you put a plastic bag and then put them back in.
You normally put a plastic bag on after that to protect the vet wrap if you want to turn the horse out. But you wouldn't put a plastic bag on underneath because you wouldn't be able to.
Put your animal insects on the plastic bag and then wrap it. Not that. And why don't you fill this cushion home club? So anybody that deals with horses and they're doing anything, please put your hat on and on this gloves, not just gloves.
Yeah, sorry, I should have said that. You did see the hat. You saw the hat in the video?
It tells you they've got to fill the heart to foot. You know, you've got the insect and you've got to fill the gaps, and within that gap between the insects.
The horse, as soon as the horse puts the foot down, it's going to fill the gap.
Yeah.
That doesn't matter at all. Poulticing is something I used to do a lot of, and now is something I very rarely do at all. Hot tubbing is what you really need to do. Poulticing doesn't really do anything. Because if you imagine, to get an abscess to burst, okay, so this is different, you've got a draining. So if you've got an abscess, you need a burst. What you actually need is heat the foot up, because you need the abscess to get bigger. That's what we need it to do. Putting a poultice on doesn't do anything, really, because you're going to put it in warm water. You can't put it in hot water, otherwise burn the horse, right? So you put it in warm water. You can imagine how quickly that cools down. It cools down practically by the time you put it on the horse's foot. So it doesn't heat the horse's foot up, doesn't do anything. It might soften it a bit, possibly, but it's not great for making the abscess burst. They're occasionally pretty useful if the abscess is draining and you want to draw it a bit, but generally speaking, a dry poultice will do just as good a job as a wet poultice in that scenario. So I tend to say you want to hot tub it, because then you are putting the whole horse's foot in warm water, and you're heating the entire foot up, and you will then stimulate that abscess to burst. Now, the difficult bit there is getting the horse to do it. We have a video. We were going to do a video about hot tubbing a horse's foot, and both horses that we tried to do it wouldn't do it, which is slightly embarrassing. So we didn't do that video because we couldn't actually get a horse to do it. So I casually say that's what you should do. I'm very aware it's difficult to do, right? So we just have to live in the real world. If your horse won't have its foot tubbed, well, you're going to poultice it. That's fine. But if you can do hot tubbing, that's better. Yes, George.
What happens if you had a blood clot anywhere in your horse's foot or leg? What would you do?
Well, so it's pretty rare, quite difficult to diagnose. You could diagnose with an MRI scan, I guess. It rather depends. Blood clots only. So what a blood clot does is, if it's big enough, it will occlude the blood vessel that it sits within, and the blood vessel in which it sits dictates how important that is, right? So if you occluded, it wouldn't do anything in the foot, actually. Short answer is nothing, because it's got a bilateral blood supply. So you've got the left side and the right side. If you block your left side, that's why if you've got an artery pumping away, technically that means there's no blood reaching that side of the foot, technically. But it all comes from the other side. Just the body automatically opens up. There are branching veins and arteries, actually. They'll open up, and that's fine, and that's what that does. So it depends on how big it is. So can it fully occlude the vessel, and where is it? So strokes are very, because if you occlude a bit of blood going to your brain, catastrophic. If you occlude a bit of blood going to your heart, catastrophic. You occlude a bit to your leg, it won't do anything. You get deep vein thromboses, which is a slightly different thing. Short answer, nothing. Yes? Yes. So, yes, it is. So, yes, it is. And we need this sort of thing. This horse will have died a long time ago, actually. It wouldn't have been put down to get its leg. It's been put down for another reason, or it's died. And we need this sort of thing. So, when I was learning about the anatomy, this is very, very useful. You can see an awful lot of stuff here that you can't see otherwise. And it's very useful learning for you guys. So if you've got an injury of a complicated area of the leg, and I'm casually saying that your horse has torn its impar ligament or its T ligament or its whatever, and you're going, what's that mean? I can go, well, look, that's its impar ligament just down in here. So I can show you what the problem is, and that's why we have these things. Back in the vet schools, it's for teaching, but when we have them here, it's so we can kind of show you what's wrong, and we have bones and things, so we can do exactly the same thing. So yes, it is real, but it's this horse it's been useful for years after its death, which is quite a nice thing, isn't it, really?
Back when I was a kid, it was always the rule that we wouldn't let the horse go down and keep walking around to let them up. Now they're allowed to go down?
Yeah, because it's so the sort of the reason to stop them rolling was you don't want them to get a twist. They're not going to get a twist by rolling. So really, what they're rolling to relieve their pain, is what they're trying to do. So really now the feeling is, well, you should just let them do that, because they're trying to relieve their own suffering by rolling. Us trying to stop them rolling, you're not helping that. You're not going to do any harm. You don't want them to roll in the box, though. Exactly. So I was going to move on to that. So you don't want them to do that in the box, because they'll start injuring themselves and they injure other people, and it's very difficult to achieve. So if you've got a horse rolling, that's probably the time they shouldn't be in the box. You should get them out and then let them roll somewhere else, preferably in a sand school or something like that, because it's dry and it's easy. So that's what you should do in an ideal world. You don't stop a horse rolling. I know in that video he said, we're stopping the horse rolling. That's because they were literally taking it to theatre, so that's why they're stopping that. But no, please don't. But call, discuss it, whatever.
How can a horse live when it's not breathing?
Well,
I would suggest quite a long time, actually. You're going to be looking at totally not breathing, which is obviously very difficult to work out. I would say 2 to 3 minutes before you start to get brain death. Thank you all very much for listening.